Kaiser Family Foundation reveals that about a third of unvaccinated adults are unsure if insurance covers the coronavirus vaccine, even though laws have been passed that bar pharmacies and hospitals from billing patients. Ryan, what do you think about this? What's the disconnect between what the public understands, and this goes through so many different issues when it comes to COVID, what the public understands about the vaccine and what's reality? Why is the disconnect there?
I think it turns out that if you lie to people for decades, they're not necessarily going to believe what you say, and particularly if you lie to them about healthcare. Insurance companies, and also Medicare is not a whole lot better about this either. And Bernie Sanders, Pramila Jayapal's bill fixes a lot. That's why they call it a better Medicare. But private insurance companies constantly lie to people and screw them over, and play games with who's in network, who's out of network. This is going to be this copay, but actually this copay over there. So people understand. A lot of people, understandably, they're not going to believe it until they actually see it. But those people should talk to their friends who went and got vaccinated and say, well, is it true that you just walk in, get your shot and walk out?
No, I think that's exactly on. I think it's, a sad statement on how confusing and tangled our healthcare system is, that something which is genuinely a pretty simple message, right? Like, these vaccines, they're free. You don't have to do anything except go in there and get the shot. The fact that that's been lost in translation, I think, speaks to how much distrust there is, and reasonable distrust, in the tangled healthcare bureaucracy in this country. And when I think about it, the messaging about the vaccines has been, I think, really bad just in general. This should have been front and center all the way through. This should have been a huge point, because it is really easy. You walk in, you get vaccinated, you walk out, and then you go back if you are Moderna or Pfizer. It's not that difficult, but that hasn't really been highlighted in a lot of the messaging that I've seen encouraging people to get vaccinated.
Yeah, and people who come here from Great Britain or France, they're more shocked at the way that our system runs. They expect you're sick, you go in, you get treated, you walk out. Like, that's the whole purpose of a healthcare system. The idea in Ohio to do the lottery to get people was pretty interesting, because that shows not only is it free, you might actually make some money. And what they had done, apparently, is they had done a bunch of polling of people in Ohio who hadn't gotten vaccinated and asked them why not. And you had some block of them who were like, I don't want the Bill Gates microchip in me. Others said, look, I don't think it's safe yet. I want the rest of you to be guinea pigs first, and then I'll try. And then a whole bunch of others said, I just haven't had time yet.
Yeah.
It wasn't that important to them. And for those people, it's like, well, what if you could win $1 million? They're like, all right, you know what? Sure.
I got time.
The CVS is right there. I'm gonna swing by and get it.
Right, and especially if it's no cost. And I think this speaks to the notion that nobody really trusts that. There's no such thing as a free shot, right? Yeah. that was Milton Friedman. But no, really, there's this immense distrust that you can walk in, get a shot, and just walk out. Everything will be good, and it'll actually be inexpensive. You're not going to get a bill in the mail. You're not going to have to deal with the healthcare bureaucracy, because that's a hassle in and of itself. Whether it's free or not, that's a hassle in and of itself. And I think to some extent, the vaccine freak out over sort of the slowing rate is kind of misplaced and overblown, because I do think eventually that chunk of people for whom it's just been an inconvenience, and it just hasn't been tempting enough given the level of inconvenience that they maybe expect, which is not true. It really is pretty easy. Right. I actually think that'll dissipate with time.
Yeah, and it becomes actually more convenient over time. Mm-hmm. In the beginning, you might be standing in line for a super long time. You were refreshing some janky website, trying to get your appointment, and then you had to show up super early. Now it's basically they've got ice cream trucks running around, sticking needles in people's arms. So the convenience is much greater. On the other hand, you are seeing a tick down in the take up of the vaccine. And at some point, you're going to have a significant number of people who are like, you know what? Look there's 5 cases in my whole state.
Yep.
I waited long enough. Now I actually don't really need this.
Yeah, I think that's true too. And I think obviously it would be ridiculous for us to dismiss the deep level of distrust that so many have when it comes to the safety of the vaccine and when it comes to, legitimately that people worry about Bill Gates' involvement with the vaccine because Bill Gates has done so much shady stuff that, if you're a casual observer of our politics, you might think, whoa, this is associated with shady Bill Gates, Epstein-connected Bill Gates. And I don't think it's helpful to sort of just dismiss those concerns offhand. But there is a question of, how many people is that actually? And I don't think we totally know the answer to that yet. But I do think some of the, establishment types that are freaking out over the toothless rubes who refuse to get vaccinated as they see them, I think some of their fears will be proven wrong with time.
Right, and as they see that people have been getting vaccinated since February and people are fine, that could encourage them to say, well, maybe the Bill Gates microchip ain't so bad after all. But meanwhile, the first human case of the bird flu has been confirmed in China. Just wonderful. A 41-year-old man was confirmed to have a rare strain of the bird flu known as H10N3. Are you kidding me?
Awesome. Yeah, this is just what we need in the world right now. But it does get to something that we've talked about a couple of times, which is this sort of pressing immediacy of actually getting to the bottom of what happened in terms of the origins of COVID-19 and in terms of China's role in obscuring those origins. And we know China had a role initially in downplaying the severity of the crisis and in spreading disinformation. And so this is scary because it shows that something else catastrophic could pop up at any moment. There's no guarantee now that we get a breather. We dealt with COVID, so now we are owed a breather. Certainly we're owed it, but the world isn't a fair place. And I guess it does get to the very pressing immediacy of our need to have specific information and specific knowledge of the steps that China took and the lengths to which they went to ensure that we didn't have the accurate information we needed to get ahead of this thing.
Right, and just what the world needs, another race for another vaccine to combat another epidemic, potential pandemic. If you remember the time before COVID, you had bird flu, and what was it, 2010? You had swine flu kicked up for a while as well, and then you had Zika, if you remember that one. Then there was fears that Ebola was going to break out, and we kept dodging bullet after bullet after bullet. Eventually, one of those bullets hit with COVID. Hopefully, this one becomes another bullet that misses the world. But with the massive increase in global population and the way that everything is just quickening in time, I had been thinking, well, we'll probably at least have several years before the next pandemic, and I still hope that that's true.
Yes.
At a minimum, and this one just kind of fades out because a lot of viruses do just mutate into a much less harmful place. Like the Spanish flu is still here, but most people are going to survive it.
And that's what scientists are already saying about this strain of the bird flu. Not that we shouldn't take it seriously, but that early indications are good that this is not going to jump to humans in a very catastrophic and disastrous way. So if you need a dose of positive news, I guess that's it.
I'll take it. I will definitely take that. Tomorrow on Rising, Andrew Feldman and Inez Stepman are Team Rising. Plus, Dr. Fauci himself joins us.
And Dr. Joe Pesci discusses the asteroid that passed Earth this week and how NASA is studying ways to deflect hits from asteroids. Remember to hit the subscribe button so you don't miss any of our videos. Also, don't forget to like and share as well. Dr. Fauci tomorrow, Ryan.
That should be a lot of fun.
That'll be great. We'll see you all then.